Thanks for joining us today. I am joined by my colleagues to my right, Sarah Feinberg, the president of New York City Transit. To Sarah's right, Craig Cipriano, the president of buses for New York City Transit. And to my left, Patrick Warren, the chief safety officer of the MTA. Thanks for joining us. We're here today to lay out the details surrounding our new subway cleaning operation and the related service changes New York City, New York City is known as the city that never sleeps, and we're the proud home of one of the only 24/7 systems in the world. Since the subways began in 1904, there have been only a handful of instances in which the subways have not operated 24/7. But unprecedented times call for unprecedented action. So beginning early Wednesday morning, we are suspending overnight subway service temporarily from 1 to 5 a.m. for the duration of the pandemic. That means that after 1 a.m. Wednesday morning, the system will be closed to everyone except transit workers and police, NYPD and MTA police and social workers. This was a very hard decision to make, but it's unequivocally the right thing to do now. The safety of our customers and employees is always our highest priority. Every action we have taken during this pandemic has been taken with that priority in mind. And my promise to all New Yorkers for the duration of this pandemic, we will do everything we can, everything possible to protect your health. That means significantly ramping up our cleaning and disinfecting efforts. This overnight subway closure will allow us to take our cleaning operation to a new, never-before-seen level. We will more aggressively and efficiently disinfect our full fleet of rolling stock and buses every single day. Touch points at stations will be cleaned twice daily. We've never undertaken so challenging a task, and as Governor Cuomo has said, this is going to take a Herculean effort. We've been in communication with our union partners as well as other unions, companies, and organizations whose workers rely on us to move them during this overnight period. I want to thank the TWU, ATU, 32BJ, UFCW, 1199 service employees, the AFL-CIO, New York Building Trades, retail workers, and the Greater New York Hospital Association for helping to inform our planning. We've also talked to the state of New York, the city of New York, and the chambers of commerce across all 5 boroughs. We've also been in regular contact with the Partnership of New York City. We will continue to move the 10 to 11,000 essential workers who are still traveling during this 1 a.m. to 5 a.m. time period. We have your back, and we will get you to work because New Yorkers take care of each other. New York City Transit and MTA buses will continue to run overnight under the new MTA Essential Plan night service, and we have developed an incredibly robust bus schedule for our customers. In total, we'll be adding over 1,100 trips and will increase our fleet of buses on the streets operating overnight by 150%. Craig Cipriano will have more on this in a moment. Sarah and Craig's team have undertaken a massive effort to enhance our bus service, and I want to thank them for their extraordinary work and leadership. And through our Essential Connector program, essential workers will be provided with for-hire vehicles and cabs on-demand rides at no cost where buses are not workable. Now for more on logistics and detail, I'll turn it over to New York City Transit Interim President Sarah Feinberg. Sarah.
Thanks, Pat. I want to reiterate that this truly is a Herculean task. The MTA has never attempted a cleaning operation of this magnitude, so please have patience with us while we get this up and running. Like Pat said, New Yorkers take care of each other, and we will get through this together. This new cleaning operation will help keep everyone healthy and safe, those essential workers who currently ride with us and our own employees. It will also give folks confidence for the future once we've moved past this public health crisis. I want to thank the mayor and the police commissioner for agreeing to significantly enhance their police presence throughout our entire subway system. This is truly going to take a village, and the NYPD providing the right amount of resources is critical to the success of our operations. So again, beginning this Tuesday night, going into Wednesday morning at 1 a.m., All 472 subway stations will close until 5 a.m. Customers should reference MTA Essential Plan night service for the last trip they can board at their station before 1 a.m. After that time, stations will be exit only. Here's what our cleaning operation will look like. On that Wednesday morning, we will surge the system with nearly 500 cleaners in terminals and yards during the overnight. It's important to remember this new essential cleaning and disinfecting operation is 24/7, not just overnight. Frequent touch points on subway cars and buses will be disinfected every 24 hours through 3 primary activities. First, there is daytime terminal car cleaning. After each train reaches its final destination, crews will remove trash, clean spills and biohazards, and spot clean floors, seats, and other surfaces. Disinfecting will also occur. This is something new. You will see more cleaners in our system throughout the day at the end-of-line stations. Most riders will recognize that this is something they typically saw overnight, but not during the day. Next is overnight yard cleaning. Trains in service during daytime hours, but out of service at night, will receive a more comprehensive cleaning every night in yards. Crews will remove garbage and graffiti, clean spills and biohazards, mop floors, clean seats, and disinfect. The third activity is overnight terminal car cleaning. Trains that remain in service at night in movement at night will receive cleaning that is identical to the yard cleaning above, except at terminal stations. While we're still learning more about this virus every day, we do know that it can live on surfaces for extended periods of time. To minimize the risk to our customers as much as possible, we're looking at innovative solutions for this cleaning program, including UV, antimicrobials, and electrostatic disinfectants. Currently, 3 antimicrobial biostats are being applied to the interior of MTA rolling stock and in control rooms and crew quarters after surfaces are cleaned with an EPA-registered disinfectant. They provide a protective barrier to help prevent germs from growing. If proven successful, we will expand their use system-wide. Next week, we will begin piloting UV technology for use on subway cars and buses. We first started to consider the use of miniaturized UV lamps back in March. Through the pilot this month, we're looking to see if UVs are more efficient and less expensive than our current disinfecting efforts. The bottom line for our customers is that things underground will look different than what you're used to. You'll probably see more cleaners than you ever have before. I know this program dramatically changes things for the essential workers who still need to travel overnight, but we will get you where you need to go. We are enhancing bus service significantly to meet your needs. The new MTA Essential Plan night service will add nearly 350 buses during the overnight and will do its best to match frequencies to the subway schedule. Many express routes will now operate overnight as well to make additional stops along subway lines. We're also preparing to add service where needed based on demand. And where buses are not workable, there's our Essential Connector program. On-demand rides will be provided for essential workers using for-hire vehicles, taxis, and liveries. We have launched a new website, mta.info/overnight, where folks can go to sign up to get more information on these programs. We encourage all of our essential workers to sign up so that we can get you the info you need immediately. Again, that's mta.info/overnight. Now I'll turn it over to my colleague, Craig Cipriano. Craig.
Thank you, Sarah. Throughout this pandemic, our core focus has been on moving the frontline workers who depend on us to get them where they need to go. Those include hospital workers, pharmacy employers, first responders, grocers, and other essential personnel. Our heroic bus operators have been doing just that, showing up day in and day out, just like they always do, and just like they did after 9/11 and Superstorm Sandy. They deliver for all New Yorkers. We'll continue to perform this important work during the overnight period from 1 to 5 a.m. when the subway is closed. We're significantly enhancing bus service, and I do mean significantly. During this overnight period, we've added 1,168 additional trips, a 76% increase, and 344 buses on top of our 235 that currently run during these hours, an approximately 150% increase. We're enhancing service on 61 bus lines, including 13 local routes and 11 interborough express routes that are added on the overnight, and 37 enhanced local routes currently already running on overnight. Enhanced local buses will typically run every 20 minutes, and some even better, with express buses running every 30 minutes. Some buses will be making additional stops to mirror subway lines. The 24 added routes are routes that our customers are familiar with, but do not typically operate overnight. We have also enhanced service to some local routes already operating. Let me give you some examples. The M15, servicing the East Side Manhattan hospitals, where frequency will be improved from 30 minutes to 15 minutes. The BX15, serving St. Barnabas Hospital, where frequency will go from 60 minutes to 15 minutes. The B44, serving Kings County Hospital, where frequency will be improved from 60 to 50 minutes. And let me give you one example on the express side. The BX-M11, connecting those in the northern Bronx to Manhattan. This route parallels the White Plains Road number 2 line between 241st Street and Pelham Parkway, and provides service to several medical destinations on Manhattan's Upper East Side. It's important to note, and I stress, that this robust bus service plan has been developed based upon data, ridership, and in consultation with leaders in healthcare, government, food service, and construction to ensure we have adequate service levels to meet demand and allow for social distancing. And we will be monitoring ridership patterns. We will flex service and remain nimble as needed to protect the health and safety of our customers and employees. Between 1 a.m. and 5 a.m., all buses, including express buses, will be fare-free, and we will cross-honor fares within the city limits on both the Long Island Railroad and Metro North. The Essential Connector program will also serve as a complement to this service plan. Customers will be provided with rides via license for hire vehicles and cabs at no cost where buses are not convenient, are not workable or convenient. They'll be limited to one trip during the 1 to 5 a.m. period. We are also partnering with our paratransit AAR partners CTG, Limousys, and Curb, and we'll have more on this coming shortly. It's important to note we'll be directing customers to our enhanced bus service first, our robust bus service plan. And now I'd like to introduce MTA Chief Safety Officer Pat Warren.
Thank you, Craig. As has been said by everyone here today, safety is the guiding principle in everything we do. To that end, I'm pleased that we've received a robust commitment from the NYPD to secure stations while our crews execute this vital cleaning program. An unprecedented number of officers will be deployed across our entire subway station system from 1 to 5 a.m. to facilitate critical cleaning, disinfecting, and maintenance, which is needed to deliver a reduced risk environment. During this time, the MTA will also be working closely with the city and state to connect more homeless New Yorkers with access to the medical care and social services they need and deserve. As Governor Cuomo has noted, the crisis underground appears to have significantly worsened in recent weeks. This isn't good for anyone, not the homeless, who are entitled to dignity and respect, not the essential personnel who still need to get around the system safely, and not our heroic workforce who go above and beyond every day to keep New York moving. It's unprecedented that anyone should live their life in a subway car, especially during a public health crisis. We all deserve better, and we're going to do better by coordinating more closely with our partners at the city and state. Until this pandemic is over, we will continue to adjust our response in the interest of safety. For now, all we can do is take one day at a time. Thank you.
We have a large number of reporters joining us today, and I would encourage anyone who is looking to ask a question among those reporters, use the electronic hands up feature, and we will be able to get to you. First question, and he's got his hand raised just the old-fashioned way, is Andrew Siff of Channel 4. Andrew.
Hi, good afternoon, everyone. My question is, given that Sarah said that a lot of the disinfecting and cleaning will be taking place during the day when trains are still running, why couldn't you do this disinfection operation without suspending service overnight?
Hey, Andrew. So plenty of the cleaning and disinfecting will take place during the day and plenty will take place overnight, but the overnight hours give us the opportunity to have access to cars that we wouldn't have access to otherwise. And everyone leaving the trains and leaving the system gives us the ability to truly clean everything. Right now, if people don't leave, we're cleaning around them. We might not even be cleaning that car. So both the removal of everyone who's on the cars, right? Everyone leaving the train and leaving the station gives us access to cars that we need, and also just gives us the ability to push in and to disinfect absolutely everything that's in the system on the overnight. Hope that's helpful.
And the next question from Clayton Gusa of the Daily News. Clayton?
Yeah, two parts. The first part, how are you guys going to address people who have emergencies and can't afford their own cab or way to get somewhere? Like if I'm in the Bronx and I need to get to Brooklyn because my grandmother is sick all of a sudden and I'm not an essential worker, how am I going to be able to use the connector program?
Sorry, I was waiting. I thought you had two questions. So.
Oh, okay. And then the other one is, does this cover a round trip or just a one-way trip, the connector program?
So it's a one-way trip, and I can, if it's helpful, I can give some additional information about how that's going to work. So this is how it's going to happen. If you're an essential worker traveling between the hours of 1 and 5, you have several options. One is to use our bus service. We've enhanced, as Craig said, and I want to applaud the buses team. They've done unbelievable work over the last couple of days to add massive amounts of service, and it has truly been heroic, and I don't think anyone in buses has slept. Not that any of us have slept, but especially in buses, no one has slept in days. So if you're an essential worker traveling between the hours of 1 and 5, here are your options. One is to use our bus service. We've enhanced bus service and added new express routes, new local service, additional routes. That enhanced service is being added to our website and trip planner now. So by this evening, people will be able to go to the website and go to the trip planner and see what the bus trip from their home to their workplace will look like. For some people, bus service is not going to work. They may live in a location or be traveling to a location where buses are just not reasonable. If bus service is not going to work for you, and in this case we would call unreasonable more than an hour and 20 minutes or more than 2 transfers, we will provide taxi and livery service, and here is how that will work. Folks need to register for our Essential Connector service. In order to do so, go to our website, mta.info/overnight, and fill out a form to register. We started that process last night. We've started collecting information from people. Once you are registered, if you need Essential Connector service instead of bus service, if you need the car service instead of bus service, you will call 511 and our call center will help you schedule your ride. Okay? We are working with taxi and livery services. I want to just say again, we are going to learn and get better as we go. So we are going to become more efficient, and we're going to learn more about the cleaning as we go. We are going to get better and be more efficient at scheduling cars for people as we go. Our bus service is going to be better and more efficient as we go through this process. This entire thing is unprecedented. We've said that so many times. I worry unprecedented is losing what it means. The ground continues to shift underneath our feet, and we continue to make changes and implement new ways to serve our ridership so that we can accommodate people the best that we can and do everything we can to keep people safe and secure. So I have no doubt there will be kinks and wrinkles, and we will have to work them out. But that is going to be the process, and we will get better as we go. I hope that's helpful.
And we're going to move on to Arthur Chen of Fox 5. Arthur.
Hi, guys. Thanks for fielding this question and giving us this information today. My question is, you say, Patrick, that this is going to last as long as the pandemic is here. So does that mean, are we looking at when there's a vaccine as the governor has defined it? So is this basically something that we could see go on for the rest of this year with no end in sight? And then the second question is, how much of a role this plan plays in the post-pandemic life of the MTA, where you're trying to balance bringing riders back in safety and having people in numbers traveling together?
So, Arthur, Dr. Fauci, Governor Cuomo don't know how long the pandemic will continue, nor do I, nor am I going to speculate or express an opinion. The governor was clear on Thursday in Albany, and our press release was clear that the cessation of service 1 a.m. to 5 a.m. would continue during the pandemic. We are all hoping that that will be sooner rather than later, but I'm not going to express a view or speculate.
And we're moving on to the next question from David Meyer of the New York Post. David.
Yeah, so my colleague Dana at Politico reported over the weekend that the MTA is testing a chemical that may be able to kill the coronavirus from surfaces up to 3 months. I'm wondering if you could confirm this, explain the name of the chemical, what the chemical could possibly do, why you're testing it, and also in Politico, Dana reported that you are swabbing surfaces and sending samples to a lab to confirm whether the virus continues to live on those surfaces. So if you could just sort of walk through that in detail, I would appreciate it.
David, a number of questions in there. First, we are testing multiple products from multiple companies. They claim, and we are in the process of verifying with federal regulators and with laboratories, that their products will eradicate the virus, including COVID-19, for an extended period of time, 30, 60, 90 days. That would be great news for all New Yorkers, frankly, for all Americans, and for all our customers. So it's multiple products from multiple vendors. We're also exploring ultraviolet light. We have done pilots with respect to the antimicrobials as well as with respect to ultraviolet. Ultraviolet is a tested, proven technology that has extensive application in hospital and emergency room uses, although unlike the other products, it does not eradicate viruses after its application. Lastly, I will say we're aggressively we are testing and piloting these things on an aggressive time frame, and we'll be reporting to the board and the public and the media as to our progress.
And we move on to Josh Einiger of WABC Eyewitness News.
Thanks, Tim. I actually have two questions, if you don't mind. The first is for Pat, and the second is for Sarah. Pat, first of all, one of the greatest things about the subway system is that it's a round-the-clock system, and it's one of the only ones of its kind in the world. There are those who would say it would benefit from not being around-the-clock because of all the capital needs. Are you unequivocally saying now that when this is over, whenever that is, it will return to a 24-hour system?
Look, our press release was clear, and the governor was clear on Thursday, that this is a cessation of service during the pendency of the pandemic.
Okay, thank you. And then for Sarah, as far as the essential connector, I guess you said about an hour and what do you say, hour and 20 minutes is the cutoff, hour 15 minutes, something like that, for the minimum of, I guess, qualifying for the ride sharing. Do you have a sense, based on just the service that's being cut and the bus routes that you put together to try to pick up the slack, do you have a sense for what percentage of the system or how many people roughly that might be on any given night, or at least in terms of areas in the system where people will likely need this service?
Yeah, it's a great question. So part of this goes back to my effort to say that we're going to learn more as we go, right? So a lot of this is going to be a work in progress, but that's where we're starting. And we don't have a ton of data about exactly where people are and where they need to go. We're obviously gathering that as people fill out the forms online, and so we're starting to get more and more of that information. We know a lot about the size of ridership in those hours, 1 to 2, 2 to 3, 3 to 4, 4 to 5. And we know generally, the number of people who are using any given subway station in those hours. So we have good pieces of data, but we don't know all of the answers yet. But that's our best. We're doing our best to make sure that we are minimizing impact here and trying to accommodate people as best we can. Again, with the amount of bus service that's being enhanced and added, our goal certainly is to make sure that we are taking care of almost everyone that way. Obviously, look, we're a public transportation agency. We want people to be using public transport, but we're going to make sure we don't leave people high and dry.
On to Streets Blog now, represented by Dave Colon. Dave.
Hey everyone. I know that there's been a lot of people asking, hey, are we sure that 24/7 subway service is coming back? But what are the metrics that the MTA is using? The measurements for ridership, for pandemic fatalities, whatever you're going to have, to bring back 24/7 service? And also, kind of along those lines, is there any elasticity in this plan so that when smaller parts of the economy start coming back, say construction, early morning riders, is there going to be opportunities to kind of tweak this plan to allow for more riders to take the bus?
Please.
Yeah, so to the elasticity question, certainly. So look, this has all been, this has been shifting on us in real time for months now. So just like the essential service plan that we did for subways when we had to reduce service because we had so many crews out, we made sure that there was elasticity there, that we could enhance service in places, that we could add bus service, that we could try to add some train service as we could. So this gives us even more of elasticity because we can add we've added tremendous amount of bus service. So I think we're going to remain as flexible as we possibly can here. Look, I think ideally we would love to be able to shorten this overnight outage and make sure that we are able to do all the cleaning and disinfecting that we need to do, but be able to serve people on either end.
All right, we move on to Dan Rivoli from New York One. Dan, you're up.
Hi, good afternoon. I have a question about the for-hire vehicle portion of this. Why did it go from 2 trips to 1 trip? And can you please take us through what you imagine would be the average commuter who qualifies for this FHV trip? Where are they going to pick up the cars? Are they going to have door-to-door service? Do they got to go to a hub? Is there going to be a taxi stand? Can you kind of take us through for the average New Yorker, the average person who needs this this taxi service, how they're actually going to get it?
Sure. So the reason it's 1 trip per overnight outage is because we did not feel like people would be both starting a shift and ending a shift between 1 and 5. If that is mistaken and people are both leaving for work and returning from work during that 1 to 5, we would certainly accommodate it. But our belief was that you're either going to work or you're coming back from work, but you're probably not doing both in that 4-hour period. So that's why it's 1. Typical rider I could see using this service would be someone whose travel to their shift or home from their shift requires 2 to 3 transfers, or taking the bus is going to take an hour and a half or an hour and 45 minutes, and we obviously want to be able to accommodate people a little better than that. So that's sort of the typical person that I see needing this service. You asked one other question. I'm trying to remember what it was.
How will someone pick up the car? So will you have taxi stands? Will it be a door-to-door service that you use your Uber app to get it, like as if there was any other trip you were making? How are they going to actually get the car? And then also, how is that going to be paid for? Is it going to be out of pocket and reimbursed, or will the MTA take care of it the way it does its Access-a-Ride program?
Right, sorry about that. I'm going to start taking notes while people are asking me questions. So right now, it's going to be door-to-door service. Look, that is not, in my opinion, that is not ideal. I would love to take people to a bus stop and have them pick up bus service from there. But the reality is just starting this program off with very little ability to plan and execute it perfectly, and moving as quickly as we are, I think door-to-door service is all that makes sense right now, because the reality is I'm just not I just don't think we're comfortable dropping someone off at a bus stop they might not be familiar with in the middle of the night at this moment. So look, as we go, if we get better and better, we may well be able to time this perfectly so that we literally can use a car to drop someone off within, seconds or moments of a bus arriving. And so that will be ideal. But it's gonna, again, this is gonna have some kinks as we roll out, and we're gonna get better and better as we move forward. And so ideally, we would be moving people to a place where they can pick up transportation. I hope that answers your question. Oh, in terms of payments, our plan right now is that no one is going to pay out of pocket. That we will resolve the payment.
And we move on to Dana Rubenstein of Politico. Dana, your question.
Hi, Pat. I just was hoping you could be a little clearer about what the metric will be that enables you to determine that the pandemic has eased and 24/7 service can resume.
Dana, sorry, I can't help you on that. We're not public health people. We're not epidemiologists. I think we'll look to the federal and state government. I think in the case of the MTA, we're likely to rely on determinations made by Governor Cuomo. But I'm not going to get into the business of describing the metrics. That's not an MTA function or responsibility.
So the metric will be when the governor says that it has eased or ended.
I think I'm not going to predict the words that the governor is going to use, but the governor will determine when steps are taken in New York State, including downstate, including with respect to the MTA. I'm not going to predict what those metrics will be or when that determination will happen beyond expressing the universal view that we all hope it's sooner rather than later.
And the next question is to Paul Berger of the Wall Street Journal. Paul, you're up.
Hi. This might be best for Pat Warren. I was just wondering about the policing of the overnight closures. Do you know, roughly how many MTA cops you're going to need? And then in addition, how many NYPD cops you'll need? And, how many has NYPD cops has the city said it will provide? Just given that it's such a huge system, and I assume they're going to be needed all over the place to clear people out.
Thanks, Paul. NYPD is working their plan right now, and so if you want to get some numbers, they'll provide them. We are going to augment them with forces as we have them available and be a good partner with them, but this is their responsibility to secure the network out there.
And are they only going to be, or mainly going to be at terminals, or is it going to be throughout all 472 stations?
Hey, Paul, it's Pat. I would add the following, that the police presence in the subways during the period from 1 a.m. to 5 a.m. is going to be at an unprecedented level, both NYPD and MTA police.
More explicitly answer your question. There will be officers at both locations, so we will have a robust force to include outreach workers at the end-of-line locations, as well as security will be distributed across the entire network to secure all the facilities that are out there.
And on to Steve Nesson. Steve of WNYC. You're up.
Hey there. Just to follow up on Paul's question, how exactly are you going to close the station? Like physically, is it going to be gates with a padlock, just police tape? And have you costed out, how much do you think all of this is going to cost weekly, monthly for these shutdowns, closures, and the overtime that would need to be paid to these officers? MTA officers, I guess you could speak for, not NYPD.
So I can tell you that there are certain stations out there that have physical barriers that can be locked, and they will be locked as soon as all the passengers and customers are out of the facilities. And then for those that cannot be locked, they will have a security force that will ensure that their security. And again, the numbers exactly will come from the NYPD. And in terms of cost, again, you're right. I don't know what the NYPD's numbers are, and we've only just begun to figure out what the overtime and regular work for our own workforce is. So I don't really have an answer for you on it.
How much is the cost of the cleaning?
Look, I've estimated that the cleaning is likely to be in hundreds of millions of dollars above the cleaning expense that was in our financial plan at the beginning of the year. We do expect that a significant portion of the cleaning, a significant portion of the additional bus service being added will be reimbursable by FEMA. With respect to police overtime, there are federal programs that we have received funding on in the past with respect to police overtime, and we'll be pursuing those aggressively.
And we welcome a first-time questioner, Colleen Wilson from the Journal News. Nice to have you with us. Colleen, you're up.
Thank you. I just had a question about Penn Station. Amtrak had said, I believe, that they started cleaning last night and that they were coordinating with MTA to have a bus for homeless people to go to a shelter. I just wanted to know if you can elaborate on that. Is that different from what you were rolling out or going to be rolling out in a couple days?
So, Penn Station is certainly one of our larger hubs out there. We have a fairly robust police force that's permanently stationed at that facility, which works in concert with Amtrak police. So there's a couple of police forces there, as well as we have a contract for social workers that also just explicitly work that assignment. And then we have transportation, different means of transportation that we use when needed, and so we assess what's going on and we act appropriately.
So nothing different is changing from what you've already been doing, I guess.
Only in the sense that there's so much less service there that some areas have been shut down significantly, but there are still some areas that will be open, and that footprint is smaller, which makes it easier to manage.
Steve Nesson's question for a second. I believe it was Steve's, and we talked about the cost. I think it's important to note here that our request to the New York congressional delegation for federal funding in the amount of $3.9 billion would obviously cover a significant portion of the increased costs, as well as the precipitous decline in fare and toll revenue, as well as a precipitous decline in dedicated taxes and subsidies. So the additional expense that we are incurring in disinfecting the stations and the other operating costs that have been imposed upon us since the pandemic began would be covered by the federal funding, and it is really fundamental and critical, given the MTA's dire financial situation, that we receive that funding.
And next up is Ben Kabak of 2nd Avenue Sagas. Ben, your question. We're not hearing you, Ben. If you can unmute on your end, that'd be great. All right, we're going to move on for the moment. Ben, we'll come back to you if you can sort it out. We think it's on your end. The next question is Jose Martinez from the city. Jose, you're up. All right, the conspiracy theorists are going to start. Hang on, Jose. We're not hearing you either. Let's do this. Let's move back to, yeah, we've had a request here to move on out the door, but we're not going to do that just quite yet. Clayton, you have your hand up again. Let's go to Clayton Gusa. We know your mic works, and then we're going to circle back to those other folks.
Yeah, is there any concern that now that you're giving free bus service and scaling it up, that you are going to see a migration of homeless people off the system and onto the buses? One, and then two, are you satisfied with Mayor de Blasio's response this morning when he said that he's not going to change any of the outreach efforts that they have in place right now, which appear to be insufficient?
Please.
So look, we are, and Tim, I'll just flag for you that something's popped up on our screen here. So on the buses issue, look, that has been flagged for us, and we have flagged that for NYPD. And obviously, we're paying close attention to that because we don't want to just move people from one place to another. And look, the public transportation system can't exist overnight only to be serving as a de facto shelter for folks who don't have another place to go. That is not the right use of the transportation system, and it's not the way that we should be treating those who need much more help than they would be getting on a bus or in a subway. So that doesn't make sense. So we flagged it for NYPD. We certainly are flagging it on our buses end. And we probably don't have the perfect solution at this moment, but I know that there has been a stepped up effort on our end and on the end of the NYPD to make sure that there are shuttles and vans and buses available at end-of-line stations to make sure that those are available to take folks to intake shelters. That is something that we've made available to those who have been seeking shelter in our system for many months. So under Pat Warren's leadership, the Homeless Outreach Task Force has, as we've been working in stations overnight, we have always supplied transportation to shelter. And so we are less able to do that at this moment because all of our bus service is going to provide enhanced bus service, but we're working with other members of the local government to do so.
We think Ben Kabak has sorted the tech issues on his end from Second Avenue Sagas. Ben?
I hope so. Thanks. I'm sorry if I missed this question before, but this is for Sarah. I know you mentioned that there was some access to cars you couldn't have otherwise by turning everything off overnight. It sounds, too, though, that trains will be running. What was the thinking behind shutting everything down overnight that you couldn't accomplish while maintaining some basic level of overnight service?
Yeah, so that was asked earlier, and the reason for shutting down the service is both because that gives us the ability to get into every single car that is in the system and clean and disinfect without having to move people, wait until customers leave. It gives us the ability to hit absolutely everything. Additionally, it gives us an added ability as we are testing products and tools and dispersal systems to do that in cars as well. And so we're doing a lot of that in the yards, but we will also be doing that, we'll be doing that in the system as well.
All right, we're going to see if we can go 2 for 2 now on the circle backs and go to Jose Martinez. Jose, try again.
Okay, hey, can you hear me now? Is that cool? Are we good?
Yeah, we're real good. Go ahead.
Okay. I believe Clayton asked something about the homeless going onto the buses. What I'd like to ask in relation to the buses is about, is there going to be any police presence, increased police presence on the bus system itself in order to stop any assaults or abuse that is inflicted on bus operators? And also for reminding the riding public to put on masks.
So the simple answer is we watch this every day, and we take an assessment of where the challenges are. And if we start to see the homeless or other issues migrate to the buses, we will take appropriate action. So we're very in tune with the issue. We want to make sure that it does not become a big issue. But if we start to see anything out there, we will make adjustments.
Next question is from Julio Cesar Garcia Torres of New York One Noticias. Julio.
Yes, thank you. The question is, has there been given any consideration to the possibility of reserving a few cars on every train for medical personnel?
So we've been focused on shutting down to make sure that we can have access to every train and to every train car. It's a good question, and perhaps as we get further into this crisis, that's something that we could look at. If I understand your question, you're saying open the system only to healthcare workers.
Or reserve the first 5 cars or the last 5 cars for medical personnel, and then the rest of the riders can go elsewhere.
I see. It is not something that we have contemplated. I mean, if you're talking about times during regular service, I think the only thing that feels more logistically complicated to me than cleaning every car is separating the population into different cars. But so I think that that would be very complicated and difficult to do, but it's an interesting suggestion.
All right, we're going to circle back now to a couple more people. Before we go, David Meyer, The Post, has another question. David?
Yeah, we had a photographer at 96th Street just now taking photos of the cleaning process, disinfecting process that was happening. And what I'm told by my desk is that the cleaners cleaned around homeless and there was nobody around to remove those homeless individuals from the train for the cleaning. Can you explain that process and why what we observed happened?
Yeah, so that's exactly what's happening right now. So we do not ask our workforce or our cleaners to engage in social services or to to engage with someone who isn't interested in moving or doesn't want to move. And certainly we don't ask people or allow people to get into a confrontation with anyone. And so that is exactly one of the many problems we are trying to solve for at the moment.
And the last question today will be for Arthur Chen, Fox 5. We'll close it out.
Thanks, guys. I guess I just want to take a look at the future ahead. Is there a possibility that when this pandemic is cleared, that you will want to maintain this closure at night in order to build rider confidence that the system is a safe place for them to converge and commute in?
Well, look, let me take that, Arthur. The way that once the pandemic subsides and the governor lifts New York pause on the downstate area, the work that we will have done disinfecting and the testing of these new products and applications will be important in being able to communicate to our employees, our riders, and everybody else, potential riders, that the system is safe, it's being disinfected regularly, and one hopes that one of the antimicrobial products will be able to eradicate viruses for 30, 60, 90 days, which would be extraordinarily good news. And we will be regularly communicating with our customers, with our employees, and with the public and the media with respect to the steps that are being taken and how these pilots, including ultraviolet, are going.
All right, we look forward to seeing all of you again real soon. In the meantime, thanks so much. Thank you, everybody.